scorpions. Near drownings, I hope he doesn't have a latex allergy. And is that a saw trap I see? Today, we are breaking down and reacting to the almost medical scenes and hair-raising scenarios from Fear Factor. Let's dive right in. Oh, no. Whoa, 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 whoa. Scorpions. I'm assuming these are scorpions that are nice, so to speak.
Be nice.
There you go. I definitely had to close my eyes. I couldn't see the scorpions being put on me.
Definitely close your eyes. So actually literally tell people this when they have to go get an MRI. Super claustrophobic event. But if you just close your eyes, you don't know that it is. Obviously, she can feel these and probably feels awful.
1, go! Come on, go!
What's she gonna do?
Get him! Calm down, calm down, calm down.
Oh.
They're spilling out of the cone. You got to keep your head up.
That was probably the worst experience I've ever had.
Ooh, putting them near your face?
In your face!
Of all of them so far, this is probably the one I would not want to do myself.
4,
Wow.
2, 1.
Oh, they're stuck on her. Wow. We don't typically get to deal with scorpion stings in our emergency department, but it depends on where you are in the United States, and it depends on where you are in the world.
Like, you don't know if they're going to be really upset and sting you or just attack you.
The biggest thing from a bite sting event that we see in the emergency department, probably common, are dog bites, cat bites. You'll get bees or insect bites. Everybody under the sun comes in with a spider bite, even though they've never actually seen the spider. Usually it's just an infection of the skin.
They're into the first room. They're trying to split up, but they just realized that they're cuffed to the rim.
Oh, we got, what are these, ordeal? Cow tongues. Oh my God. Those things are huge. Actually, it looks like a liver almost. The shape of the liver, basically like a big triangle. The liver is actually bigger in a human, but this type of tongue looks like it a little bit.
Definitely disgusting, whatever is in there. Is that the key to the handcuff, or is that one of the 3 keys they'll need to get to the next room?
Pig snouts? We have all this blood. The question is it actually like real blood or is it fake blood? Blood is typically quite dark like that. It probably would be clotting if it was sitting for a while. In like Hollywood, they typically would use corn syrup and some sort of like dye.
Our strategy is me looking through like the intestines and stuff. Got it.
They found the second key.
While she was trying to unlock the handcuffs, but
Cow
it was definitely
intestines.
hard.
So the intestines here, hard to tell the anatomy of the intestines that we're seeing. They're pretty huge, twisted pieces of tissue. It's smooth muscle. It has multiple layers.
Got it, I got
Got the
it.
4th key.
Unlock it.
See how they're wearing a white t-shirt and see how it's like splattered with blood? That's what this would look like if I wore it at work. Blood really stains and it's really hard to get blood out of materials. That is why we don't wear that. That's why we typically wear hospital scrubs and darker colored scrubs.
I'm gonna have to be chained up while seeing my brother suffocating. I hope he doesn't freak out. Don't be a dude, $50,000 on the line.
Suck out the air.
So sucking out all the air. If somebody is healthy and you stop breathing, you potentially have like 6 to 8 minutes of oxygen in the body before you drop below 90% of your pulse oximetry, your oxygen saturation.
Please do it, dude. It's really hard to breathe. Dude, I can't even move. I'm losing feeling in my legs, Max.
Shrink wrap down to the table where he can't expand his chest. So then your breaths are very, very shallow.
One lock down. You got one lock?
He's got the first lock. You got 1 lock. All right, Mac.
I play around with latex with my girlfriend.
Latex, in that instance, helps protect you from any STIs, as well as a good barrier, not a perfect barrier, relating to family planning.
Oh, hey! All right, okay.
Go get your brother out. There you go. Inappropriate use of CPR, but is checking to pretend to do CPR, right? We've talked about CPR before. First, check to see if somebody has a pulse and make sure that they are breathing or not.
One of you will be strapped into this electric chair.
Whoa, electric chairs, not cool.
If you hit the sides of this fence, you will be electrocuted. Here's the kicker. Every 15 to 20 seconds, the person inside of this chair will be electrocuted as well. 1, Go!
I'm assuming the voltage and amps are very low. You increase the risk of having cardiovascular events. These are most likely AC currents versus DC.
As soon as the first shock hit, my hands just cramped up.
You can cause muscle breakdown. You can cause rhabdomyolysis. If you have muscle breakdown leading to rhabdomyolysis, you increase the risk of kidney failure, and you increase the risk of something called hyperkalemia. If that occurs, you can go into cardiac arrest.
Cardiac arrest! The fact that she was there screaming and crying, that was worse than me getting
this is
touched.
awful.
That was a little bit more motivation on my end. I got you. I got you.
Fourth king.
Increased amount of stress equals inability to have good fine motor skills because your adrenaline is kicking up, so you actually will shake a little bit. Oh, who's got an issue with water? Let me know in the comments. Gotta hold your breath.
at the bottom and Marissa has the top.
Oh, okay, all right. So at least there's a place to grab some air.
They did it a little different than you guys. Started out with breathing. It seems like Mackenzie's the one that's struggling.
So you gotta, one, do activity underwater, increasing your oxygen demand. And then when you start feeling like you can't breathe, you actually start to panic and you increase oxygen demand.
Demand suddenly skyrocketed.
Uh-oh. Hold on, Marissa's in trouble. Marissa's in trouble. Breathe. They are struggling to breathe.
Definitely be stressful. You don't want to be swallowing water. You don't want to inhale water, increasing the risk of like a pneumonitis. You won't necessarily get a pneumonia or an infection of the lung right away. You'll just get irritation of the lung tissue itself, which causes inflammation.
It's out. They got it. Uh-oh. Marissa's going the wrong way. You need to breathe.
Got her. Oh my gosh, that's the worst. So it gives an example of a little bit of disorientation that can happen under the water as well. Oh, these are just looking like flies, like the annoying flies that come zinging around and make lots of noise. Oh, don't inhale them. Stop it. You gotta eat them? Kill them? What are you doing? Chew them up?
Trying to chew was probably the worst part of it all. In my face and my nose, the smell was unbearable. I freaked out.
Yeah, this is definitely a no for me.
Gotta be no, dog.
I don't need to be eating flies. Often enough, I pull different types of bugs out of people's ears. Is probably the most common place where a bug ends up. Sometimes it's a fly, sometimes it's a roach, sometimes it's an earwig.
Devin is 2 marshmallows down. And Tiana ate 1, so 5 more to go.
Oh, so they're not eating the flies, they're trying to eat the marshmallows.
It was like an army of insects trying to attack me, buzzing around my ear.
Oh, the ear is the worst. Sometimes patients, they almost feel like they're going mad because the fly typically, or the insect, is moving still inside the ear canal, making loud noises and potentially irritating the tympanic membrane, aka the eardrum.
Please get this out! Please get me out! Get me out! Get me
Oh,
out!
it's broken down.
Come on, y'all do it, man.
I have people that come in that are having psychosis or mental breakdowns where they believe that they have infestations of bugs in them and eggs that are laying under the tissue or in their bodies. Usually it's not the case. A lot of bugs and a lot of stuff going on. Let me know what's worse. Is it like the creatures, the bugs, the grossness, the confinement? For me, it is definitely the bugs. Also, I made fast-acting health supplements with you in mind. No matter what the issue, I got you covered. Check out Life Happens. You take them only when you need them. If you guys enjoyed this, definitely check out this playlist right here and binge watch everything. And as always, do me a favor, please subscribe, turn your bell notifications on, and hit that like button. Thank you so much for watching, and stay healthy, my friends.